Welcome to CaregiversTrainingVideos.com. Hi, my name is Jose Silva, and I'm your host for this episode. CaregiversTrainingVideos.com specializes in giving family caregivers the learning tools necessary to succeed in the residential environment. The learning objective during today's episode is how to use a full-body manual hydraulic lift. Patient lifts are used to enable the caregiver to transfer a resident from the bed, wheelchair, commode, floor or similar surface to another surface and reduce the risk of injuring yourself and the resident. Patient lifts mainly fall into two categories, manual and power operated. Some versions are collapsible in design, while others are designed to assist with ambulation, gait, and automobile transfers. Manual patient lifts are hydraulically operated by a pump handle. The power-operated patient lifts are battery or electrical controlled. I will review the battery and electrically controlled patient lifts on a different episode. Home Health Care Training Corporation used its best efforts in researching and preparing for this video topic. We encourage the viewer to further expand their knowledge on this subject for more accuracy and completeness. Additionally, the demonstration you are about to view is for informational purposes only and not intended as medical advice. Please obtain approval from the resident physician or medical professional prior to using any type of device and physical program. Also, read and understand manufacturer's guidelines prior to operating any devices. We do not assume any liability or responsibility for damage or injury to person or property from any use of information or instructions contained on this website and video. Allow me to introduce the full-body manual hydraulic patient lift features. The structural parts of the manual lift are the base, mask, and boom. The controlling parts are the swivel bar, shifter handle, hydraulic pump, control valve, pump handle, and steering handles. You must take several precautions before using the lift. 1. Use surgical exam gloves. 2. Make sure the resident's weight does not exceed the weight capacity of the lift and sling. 3. Consider the sling type you need to utilize. 4. Inspect the sling for any defects such as tears, loose stitching, or broken sling loops prior to use. 5. Always use good lifting techniques. Therefore, use your leg strength for leverage. Keep your back straight when possible and never twist your body while lifting. 6. Ensure you remove uneven floor surfaces that may cause the lift to tip. 7. Check under the beds for any obstacles and ensure the lift base has the height clearance to fit under the bed. 8. Ensure the hospital bed is secure by locking the wheels. 9. Bring the bed height to a safe level. And 10. Practice transferring from bed to wheelchair, wheelchair to bed, or other seating surfaces before lifting the resident. We will now demonstrate how to use the full-body hydraulic manual lift by transferring a resident from the hospital bed to a wheelchair. Always explain to the resident what you're about to do. Review the process from start to finish to reduce any anxiety that the patient may have with the transfer. First, bring the wheelchair near the bed and swing the footrest out of the way. Secondly, engage the wheel locks brakes to prevent the wheelchair from moving. Third, then explain to the resident that their body should be shifted from one side of the bed to the other so that the sling can be positioned for the lift. Fourth, always lower the bed rails on the transfer side. Fifth, then position the resident to the center of the bed. Sixth, fold the sling in half and place the sling next to the resident. The top of the sling should be at the shoulder height. 7th, lift the resident's leg closest to you and have the foot placed flat on the bed. 8th, raise the side rail and position yourself on the other side of the bed. 9th, lower the bed rail and gently grasp under the knee with one hand and under the shoulder with the other hand. 10th, roll the resident towards you and place the wedge such as a rolled up towel at the back if the patient cannot hold the side position. 11th, then place the sling under the resident. 12th, remove the wedge and roll the resident back to the prone position. 13th, also raise the bed rail. 14th, you should position yourself on the transfer side of the bed and lower the bed rail. 15th, and repeat the process. 16th, lift the bed rail. 17th, since the bed rails are secure in the up position, you can steer the manual hydraulic lift near the bed. 18th, open the leg base. 19th, ensure the boom level is higher than the patient to prevent any injury. 20th, lower the bed rail on the transfer side. 21st, steer the lift so that the swivel bar is parallel to the patient's shoulder. 22nd, turn the control valve to release the hydraulic pressure to lower the boom and swivel bar. Then secure the control valve. 23rd, attach the sling loops to the swivel bar and give the lift a few pumps to provide tension to the sling. Ensure the sling is attached to the swivel before lifting the patient. 24th, lift the resident up several inches above the bed surface. 25th, gently swing the feet away from the bed. 26th, then position yourself behind the lift. 27th, steer the resident away from the bed and toward the wheelchair. 28th, center the resident into the wheelchair. 29th, never pull or push the boom while the resident is secure to it. 30th, slowly open the control valve to lower the resident into the wheelchair. 31st, the resident's hip should be positioned as far back into the wheelchair as possible. 32nd, unhook the sling from the swivel bar and steer the hydraulic lift away. 33rd, safely remove the sling from the resident. Congratulations! Now you have the tools you need. Remember, more you perform resident transfers with the full body manual hydraulic lift, the more proficient you'll be. That's it for this episode on caregiverstrainingvideos.com. Please visit our sponsor's website for exciting offers and information, and email us with your comments at the link below. Thank you for visiting our website. Again, I'm Jose Silva, and have a great day.